If you are trying to conceive, or you have fertility challenges, or if you even have unexplained infertility, I would like to offer you hope. I'm Dr. Ron Thompson, and almost 30 years ago, my partner and I pioneered and developed the laparoscopic gift procedure. For over 30 years, I've been interested in helping women to conceive and to become mothers. Vaginal lubrication is important, and not only important, but essential for conception. It takes the normal physiologic process of the vaginal lubrication of sexual arousal for the woman to produce this lubrication to actually capacitate the sperm. The sperm capacitation from the natural conception lubrication, which is in the vagina, enables the sperm to swim the 6 to 7 inches to the end of the fallopian tube in the ampulla, the only place that conception occurs. To conceive is applied to a woman's genital region, especially the clitoris, and causes a reflex vaginal lubrication. The clinical studies show that it causes increased vaginal lubrication for 80% of all women, but 90% of women beyond the age of 30. There are only 2 days a month that a woman can conceive. Once the egg is ovulated, it's taken up by the end of the fallopian tube, the ampulla, and that's the only place that it sits for a day or two and can be fertilized by capacitated sperm. In my vast experience, most causes of infertility are because there's a little bit of a problem with a man and a little bit of a problem with a woman. Maybe the man has a decreased sperm count or increased amount of abnormal sperm. Maybe the woman has inadequate sexual arousal and inadequate vaginal lubrication. And the combination of the two of them causes the infertility. I think it's always best to correct all the factors that you can so that you optimize the chances to have a conception, because you only have a chance 2 days of every month. I would still advise having intercourse on a daily basis using the to conceive for the 2 days that you're most fertile. And you can tell that with ovulation predictor tests. Also, before any patient starts attempting to conceive, they should use the brand new sperm check that will tell if your husband has an adequate sperm count. Now, that doesn't tell if there are too many abnormal forms. It doesn't tell if the sperm are too immature. It doesn't tell if there's a chronic prostatitis, other problems, so that if you use the sperm check and he has an adequate sperm count, and you use the to conceive, and you're not pregnant within an adequate amount of time, you might want to have your husband visit a urologist for a complete workup. For all of the patients trying to conceive, I offer you hope. The hope is that you can use the to conceive to naturally and spontaneously conceive. My wife and I were in our 30s before we had any children, and we have 4. I offer you hope.